Hey, this is Dr. Mark Richard, orthopedic surgeon at Duke University. And today on Diamond Doc, we're going to talk about hamstring injuries. Now, this may not be the most exciting topic, and it may not be the most visible injury, but it is the most common lower extremity injury in Major League Baseball. A review of the MLB injured list over 7 years revealed that the overall incidence of hamstring injuries in fielders was nearly 14%. This means that nearly 1 in 7 of every lower extremity injury is a hamstring problem, most commonly a strain. Given the prevalence, Ahmad and colleagues took a deeper dive into a single season and found that nearly 2/3 of cases occurred while running to first base. These injuries are not without disability. 2/3 of all players missed at least 1 week of playing time, and 1/4 of players missed a month of playing time or more. Other identifiable risk factors included a history of prior hamstring injury the year before. And it was noted that the majority of injuries occurred at the start of the season, suggesting that conditioning and/or colder weather may have an effect on hamstring strains. So what are the hamstrings and why are they at risk? The hamstrings are a group of 3 strong muscles on the back of the thigh, the biceps femoris, semitendinosus, and semimembranosus. By definition, the muscles cross both the hip and knee joints and exert their action on each. The hamstring muscles extend the hip and flex the knee. In orthopedics, muscles that cross 2 joints and serve more than one function tend to be at greater risk for injury, and this certainly holds true for the hamstrings. So how do we rehab hamstring injuries? Like most injuries, the rehab phase consists of 3 basic stages: rest, stretching, and strengthening. It is critical to remember these and work through these, ideally with a trainer or therapist. The most commonly made mistake is skipping the rest phase. Many athletes immediately stretch the hamstring after an injury, but this may just delay healing by exacerbating the injury. Ice and rest are appropriate for the immediate time frame after an injury. This is followed by a progression through light stretching and progressive strengthening with eccentric and dynamic loading. Once this has been completed, return to play can be considered. Many athletes underappreciate the time required to rehab a hamstring, likely contributing to an injury recurrence rate between 20 and 30%. The best treatment remains avoidance of injury. Maintaining a good off-season regimen of stretching and strengthening can keep you best prepared for the start of the season. And in the colder months in the beginning of the year, be sure to stretch appropriately and be warmed up before maximal effort. Do you have other questions about hamstring injuries in baseball players? Please respond in the comments and ask your questions using the hashtag USAB mailbag.